So you've been trying to get pregnant for some time now, and you just saw that home pregnancy test weekly positive or proper positive. What does that mean? So anytime the test shows weekly positive or positive, it is positive. That means the hormone is in your body. But there are some patients who would do the test so many times, and then they'll start comparing the test, and then one of them will be like slightly different color. That is just anxiety speaking up. And they will show me that, listen doc, I did this at this much time, this much time, this much time, and see, this one looks positive, and they're all actually negative. But when it's positive or it's faintly positive, you do see a color instantly. Okay, so that means it's a positive test. That means you have the pregnancy hormone in your body. Now what do you do? So if you have missed your period, I would suggest, like, suppose you did the test just when you miss your period, so that's like 4 weeks from the last period. I would want you to wait for another week and then repeat the test and see if it's still positive or you got a period. If it's still positive and you didn't get your period and you start feeling these pregnancy symptoms like nausea or breast tenderness, that's when most likely you are having a good pregnancy. So if you are not taking folic acid, you need to go and get yourself a folic acid. 400 milligrams of folic acid is good enough, but if you want, you can take a 5 milligram. 400 micrograms, yes. So that's all you need when you get the pregnancy test positive. You don't need to go and tell the whole world and get anxious about it. You don't need to really go to the doctor right away to confirm it with a blood pregnancy test, because guess what? Just like you, if you're anxious, your doctor is going to be equally anxious. So when a patient walks in to confirm a test, they obviously offer you a blood pregnancy test. But when the hormone is low, they would offer you a repeat test in 48 hours to see if it's doubling. Sometimes it doubles, sometimes it does not double, and all of that nonsense which starts. I would want you to save yourself that trouble. Okay? So if your test is positive, weekly positive, hold on tight, be patient, wait for a week. If no period comes, then do a pregnancy test. Generally, suppose you go to your doctor and you have done the pregnancy test, the blood pregnancy test, and you have a hormone value because of your fertility history and all of those like stress around getting pregnant. Generally, the hormone value needs to be around 2000 for the pregnancy to be seen in a transvaginal scan. So if it's not 2000, you have to wait. Of course, while you're waiting, if you get pain in abdomen or bleeding, you need to go to the doctor right away. But if everything is fine, just slight tenderness in the abdomen, and you literally might feel that your period is going to come but nothing is coming, that can happen even with a healthy pregnancy. So don't worry. Your only warning symptoms are period-like bleeding after having missed your period and severe pain in abdomen, something which is really more than your period cramps. All right, so that's all you need to know about what to do when your home pregnancy test has come positive.